Are there any limitations to virtual veterinary care? In recent discussions about pet care, a pressing question has emerged. Are there limitations to virtual veterinary care? With more pet owners turning to online consultations, it is essential to understand the boundaries of this service. Many people are searching for answers on how effective virtual care really is for their pets. While virtual veterinary consultations offer accessibility, they cannot replace hands-on physical examinations. These examinations are often necessary for accurate diagnosis and treatment. For instance, conditions that requiring palpation or auscultation cannot be assessed remotely. Detecting subtle signs of chronic diseases often relies on diagnostic imaging and lab tests that necessitate a visit to a clinic. Additionally, certain procedures such as vaccinations, surgeries, dental cleanings, and emergency care cannot be performed virtually. These procedures requiring in-person visits to ensure safety and effectiveness. This limitation can be a concern for pet owners who may think virtual care is a one-stop solution. Another factor to consider is the regulatory and legal restrictions that vary by region. In some areas, a veterinarian-client-patient relationship must be established before prescriptions or diagnoses can be made online. This often means that at least one in-person visit is required. Furthermore, virtual care relies on pet owners having reliable internet access and the ability to use technology. This can pose a barrier for some individuals, particularly in underserved or low-income communities. While virtual consultations can reduce travel and time costs, they do not fully address affordability issues related to veterinary services. Lastly, virtual consultations may not be as effective for complex or severe cases. These situations often requiring detailed diagnostics and immediate interventions that can only be performed in person. Virtual care is best suited for follow-ups, minor ailments, behavioral advice, and determining if an in-person visit is necessary. In summary, while virtual veterinary care improves access and convenience for many pet owners, it cannot fully replace in-person veterinary services. The need for physical examinations, procedures, legal requirements, and technology access clearly outlines the limitations of virtual care. It serves as a useful complement to traditional veterinary services but has specific boundaries in its application.